Intellectual and developmental disabilities. Look at the terminology listed on the screen. How many terms have you heard of, read about, or used before? The language that describes students with intellectual disabilities requires clarification. The term mental retardation was widely used until recently to describe people with intellectual disabilities. Many families, advocates, researchers, and other professionals in the field felt it had an offensive connotation, leading to terminology changes eventually signed into law. On October 5th of 2010, President Obama signed into effect Rosa's Law, a bill that immediately changed the term mental retardation in all federal applications to intellectual disability. The term developmental disability, which you will hear in your professional career, means symptoms must begin in early childhood, may impact everyday functioning, and typically last throughout a person's lifetime. Check out the Not Acceptable R-Word PSA.
It's not acceptable to call me a nigger.
It's not acceptable to call me a spick.
To call me a chink.
To call me a fag.
It's not acceptable to call me a kike.
And it's not acceptable to call me a retard or call yourself or your friends retarded when they do something foolish.
The R word is the same as every minority slur. Treat it that way and don't use it.
Spread the word to end the word.
With the change in terminology, there was a lot of advocacy on getting the word out about the terminology change. We're More Alike Than Different was another campaign to get the word out about people with disabilities and help create a sense of understanding.
No, Down syndrome does not slow me down. It's just what I have in me. I do have Down syndrome, but that's not going to stop me one bit. See, I live on my own. I clean the house. I do exercise. I walk my dog. She's an outside dog. And I got 3 other brothers. They don't treat me special. My name is Mark Joseph Hubler. I'm from Indiana. A Hoosier fan. See? We're more like than different.
My name is Moira Rossi. I'm 20 years old. I go to the University of North Florida. I love college. It's the best thing. I'm studying right now career planning and journalism. I'm also taking voice lessons. I want to sing on American Idol and kind of win Simon Cowell over. See, we're more alike than different. My goal is to be successful and be an international sensation.
My name is Christopher Scott, and I'm from Texas. I'm 31 years old, and I have Down syndrome. Well, I like my job. I'm a teacher assistant, and I work with kids. That's where I get some of my energy from. I like lots of movies. So I like to go dancing, get my groove on. See, we are more alike than different.
I am Christy Hockle, and I am 29 years old, and I have Down syndrome. Yes, I just joined the gym. I love to exercise. Exercise is my thing. I can lift 140 pounds. I just love it. I just love being there. It's really fun. I like to get healthy and strong and skinny. See, we're more alike than different. My mom keeps saying, Christy, you need to listen right. I am Christy Hockle. I am 29 years old, and I have Down syndrome. Something special just happened to me. My boyfriend asked my dad in the hand of marriage. He's wonderful. He's cute. I love him a lot. I want to be beautiful as a bride. See, we're more alike than different. I'm going to have a big wedding for 300 people.
If you like the More Alike Than Different, You'll note that there's an additional segment in the end of the module that you can check out. I just wanted to bring back our pie chart, and before we take a look at the federal definition, let's review the categories of eligibility to see where intellectual disabilities fits. It is right here, the orange category. It is the 5th largest category serving the student population in school right here. The federal definition of intellectual disability according to IDEA is, quote, significantly sub-average general intellectual functioning, existing concurrently with deficits in adaptive behavior, and manifested during the developmental period that adversely affects a child's educational performance, from our Friend textbook, page 233, the 2018 version. Looking a little deeper, there's 3 criteria that must be met. 1, deficits in intellectual functioning. 2, deficits in adaptive functioning or adaptive behavior. And 3, the onset during the developmental period, considered before age 18, although this is not specified specifically in the DSM-5. Let's take a deeper dive into both intellectual functioning and adaptive behavior. Intellectual functioning is sometimes referred to as IQ or intelligence quotient. What is it? How do we measure it? What can it tell us? In intellectual disabilities, intellectual functioning deficits are usually confirmed by both clinical assessment and an individualized standard test. The deficits are typically in functions such as academic learning, abstract or critical thinking, problem solving, and even reasoning. You may have seen the bell curve before, or the normal distribution of intellectual or intelligence test scores. And there's much controversy surrounding the use of IQ test scores, but I just want to give you a brief overview. An average IQ score is 100, so right here in the middle, and we call that average score the mean, with a standard deviation of 15 points on each side of the mean, meaning 85 to 115, this range right here, 68% of the population is considered average, with 85 being very low average and 115 being very high average. In the case of intellectual disabilities, we're looking at 2 standard deviations below the mean. So starting right here, the population right here. So if we're looking at 2 standard deviations below the mean score of 100, it's these 2 far left columns on the graph between 0 and 70 IQ. But what is a score really? Can it tell us anything about a person? What does it provide? What it does provide is a mechanism for eligibility and therefore funding. But every child is so vastly different, and there are valid questions regarding the use of IQ assessments. Severity specifiers are based on adaptive functioning rather than IQ. Sometimes people with intellectual disabilities fall in a more mild range or a more moderate range, and we base that more on their ability to use daily living skills or adaptive behaviors, those things that are necessary for independence, than we do on IQ. Individuals with intellectual disabilities have deficits in adaptive behaviors, such as communication, the ability to exchange thoughts and ideas. Think about all the times that you communicate throughout the day and with all the different people and in all the different scenarios, with friends, families, colleagues at work, and teachers. Those communication skills can be challenging for people with intellectual disabilities. Look at self-care, the ability to care for personal hygiene and have good eating habits and good exercise habits and good sleeping habits. Again, all of these things can be challenging for all people with or without intellectual disabilities, but they tend to be more difficult for people with intellectual disabilities. Social skills, the ability to interact appropriately with others. Home living. Think about the day-to-day things like paying bills on time and managing a checkbook and budgeting and all of the housekeeping things you do around the home. Leisure, the ability to use free time wisely, health and safety, self-determination, functional academics, work, and community. All of these things can be challenging for people with intellectual disabilities. To what degree is different for every individual. Let's take a look at the cognitive and academic characteristics that can be impacted for individuals with intellectual and developmental disabilities. Now, these are just a few, but we're going to focus on the primary ones. Memory, especially working memory, is the ability to remember what needs to be done and the timeline allotted to do it. It's important for reasoning and guidance of decision-making and behavior. Generalization, that ability to learn a skill or a task in one setting and then apply it in other situations or settings, can also be impacted. Language is typically delayed. Oftentimes individuals have difficulty with abstract concepts or ideas or language terms. Motivation is also sometimes impacted, or we see something called learned helplessness, that tendency to give up before you even try, or to just have that mentality that I can't do it, or I'm not going to do it, or I'll fail even if I try. So that inability to even want to attempt something. Metacognition is a term that we use, that we call it thinking about thinking, or the process of being aware of your own thoughts, or knowing how you're thinking or processing through something. Academic skills in general, reading, writing, math, can be very difficult. They have to tend to work harder and practice longer. And information processing is slower, so it takes more repetition and more practice and more time to learn something. For the most part, we don't know what causes intellectual disabilities. We do know that in most of the mild cases, the cause can't be determined. Mild is about that area is about 85% of all people with intellectual disabilities diagnosis. Typically, we talk about the causes and we consider them in terms of when they occur. Is it prenatal, perinatal, or postnatal? Prenatal is during gestation, that time that the mother is pregnant or carrying that baby before the baby is born. Perinatal is at birth, and postnatal is after birth. Some of the prenatal causes from the Friend textbook include chromosomal abnormalities like Down syndrome, Fragile X syndrome, or Prader-Willi syndrome. Other prenatal causes aren't necessarily chromosomal, but fetal alcohol syndrome, PKU or fetal ketonuria, or toxoplasmosis. We're going to take a deeper dive into each of these prenatal causes in an activity that we do next. Some perinatal causes of intellectual disabilities are a baby being premature or preterm, and babies that have a higher risk are less than 3.3 pounds. Now, this doesn't mean that if a baby is 3.3 pounds or less that they're going to have an intellectual disability. There is just a correlation there, and they are at a higher risk. Other things that can happen at that time of birth are deprivation of oxygen, whether maybe the umbilical cord got wrapped around that baby's neck and they went without oxygen for a while, or the incorrect use of forceps. Some postnatal causes or causes after birth can be accidents or illnesses during childhood, like encephalitis, lead poisoning, or brain injury. Next, we're going to dive into some of those causes with an activity.